Assalamualaikum everyone, welcome back to this channel. This is me Ali Wahid and you are on the channel of Medicare. So as you know that we have started the lectures of anti-cancerous drug. So in today's lecture we are going to start about the platinum coordinate complexes. So in platinum coordinate complexes, we have three drugs here: cisplatin, carboplatin, and oxaliplatin. So, what are the platinum coordinate complexes? So, these are the types of the anticancerous drug that bind with your DNA, and they are inhibiting the replication of the DNA and causing the cell death. So now we will start to study it. So the first drug is cisplatin. This is the first member of your platinum coordinate complexes, the class of anti-cancerous drug. But because of severe toxicities, carboplatin is developed. So your cisplatin has a lot of toxicities. That's why we need carboplatin for it. Okay, so the next thing is that the potency and the pharmacokinetics and the pattern of distribution, dose limiting toxicity is significantly between the two drugs. Cisplatin has significantly synergist cytotoxicity with radiation and other chemoradic agent, and it is found wide application in the treatment of solid tumors. So these are the uses of cisplatin, that it is effective for the solid tumors like testicular cancer, ovarian cancer, and the bladder cancer. Okay, these things are written here for it. Next is the carboplatin. It is used when the patient is not vigorously hydrated and is required for the cisplatin treatment. If the patient is not too much hydrated, then we move toward the carboplatin, and they suffer from the kidney dysfunction or prone to neuro or ototoxicity. So those patients who have kidney dysfunction or their auto or nephrotoxicity can occur, we can give them carboplatin, while oxaplatinum is the closely relative analog of your carboplatinum, is used in the collateral cancer. Okay, now they have given you the mechanism of action of them. Their mechanism is that in the plasma where we have the high chloride environment, it remains neutral. So they are activated when they enter the cell. And why in plasma they are remain neutral? Because of the high chloride environment at that site. And when they enter inside the cell, now we have the low chloride environment, meaning inside the cell we the concentration of Cl ion is low. That's why it binds with the guanine in the DNA. It formed the cross link in the DNA, blocking replication and DNA synthesis. Work best in G1 or S phase. So it will bind with the DNA, guanine specifically, and work in two phases of cell cycle. First is the G1, and second is the S phase of cell cycle. Okay, next we will talk about the its mechanism of action through the book. So the mechanism of action of these agent is similar as that of alkylating agent. Why it is similar? Because it is also inhibiting binding with the DNA and inhibiting the RNA or DNA synthesis. In high chloride environment of the plasma, cisplatin is neutral. But when it enters the cell, because inside the cell we have low chloride, so it binds to the guanine and it form the cross linkages, inter or intra linkages it form, and it will inhibit both DNA or RNA synthesis by blocking the polymerase enzyme, and it also effective for both cell cycle G1 and S phase. In both of these phases it will inhibit the DNA and RNA. Next, we will discuss the pharmacokinetics of them. We can give IV administration, intraperitoneal administration in case of ovarian cancer. Intraperitoneum is best, and we can give intra-arterial introduction if we have any specific organ cancer. These are all its pharmacokinetics. its higher concentration of drug is found in, so it is well distributed, and it's well concentration found in liver, kidney and intestine, and it can also cross the CSF. That's why it can treat the brain tumors. Now the adverse effects, simply I am telling you the adverse effect written in whole this paragraph. The adverse effects are like severe vomiting, nephrotoxicity, ototoxicity, and electrolyte imbalance. But your carboplatinum, it has some less toxic effects than the cisplatinum. Cisplatinum has more nephro or ototoxicity. So the patient who have kidney dysfunction or already facing the problem of ototoxicity, that we will prefer the carboplatinum in those kind of patients. So that's why you have to prefer carboplatinum for those patients who have the kidney dysfunction. While the mechanism of action of carboplatinum is just similar as the cisplatin is, its administration is IV or intraperitoneal route, and the adverse effects are mostly same, except of myelosuppression. Next, oxaplatinum. The oxaplatinum is mainly for colorectal cancer. So this is a specific type of cancer for which oxaplatinum is very good. Mechanism of action is of all the three drugs are similar. Administration is through the IV route, and the adverse effect of oxaplatinum includes the cold induced neuropathy, which is temporary, and it can be returned back within the 72 hours. And the next adverse effect that can be caused through the oxaplatinum is the cumulative peripheral nephropathy. Due to long term use or the due to repetitive dose of oxaplatinum, it can affect our neurons, and it can induce the cold, which is temporary, which revolves after taking the drug, and within the 72 hours of taking that drug, patient can feel cold. And myelosuppression and hepatotoxicity is done by every drug of this class. So now just we revise shortly revise what we have studied. Now we have studied platinum coordinate complexes. So these are those drugs that form complexes with your DNA. It will bind to your DNA because they have platinum in them, and they will block the DNA replication. Three drugs in it: oxaplatinum, cisplatinum and carboplatinum. The cisplatinum, it has more toxic effects, so it cannot be given to a patient who have renal dysfunction, nephrotoxicity or ototoxicity. For those kind of patient we will give carboplatinum. While the mechanism of action and mostly the adverse effect are of all of these three drugs are mostly same. Cisplatinum, the specific things for cisplatinum is that it is for solid tumors like testicular tumor is the solid tumor, ovarian cancer or bladder cancer. These are the solid tumors like cancer. Next, if we revise the mechanism of action of all the three drugs, they are inactive when we have high chlorine environment, for example in plasma. But when they enter into our cell, here they get a low chloride environment. Here they will bind with your DNA, form the complex with it, and inhibit the DNA and RNA replication and their production. And next is the carboplatinum, and the specific use of carboplatinum is with the kidney failure patient. And oxaplatinum, it is very good for colorectal cancer. So this is a type of a cancer for which oxaplatinum is very good. And adverse effect, two specific adverse effect of oxaplatinum we have studied, which is the cold induced nephropathy, which is temporary and which is only for 72 hours. This is written in your book that cold induced peripheral nephropathy occur within the 72 hours of administration. And cumulative nephral neuropathy, it is can be occur when we have long term or repeated dose of any oxaplatinum. So this was all about our today's lecture. I hope that you will learn a lot about it, and your concept will be clear. In the next video we will cover another classification of anti-cancerous drug. So take care, meet you soon in the next lecture. Allah Hafiz.